Hi guys, Coach Suze here again for you today, and today's topic is going to be a very interesting one. We're going to talk about the importance of exercise when taking the so-called the shot, which is any type of the GLP-1 receptor medications. The most famous one might be Ozempic, but there are a lot of different types out there now. So the results of the study may not be as surprising, but it just further confirms that exercise is a very important thing when it comes to maintenance of weight loss. So, in this particular study, what they tested is basically how including exercise basically helped the patient maintain their weight loss, right? So, basically, it was a randomized control trial, right, from Denmark. Participants went through the weight loss phase of 8 weeks, and then 52-week randomized controlled weight maintenance phase. Created 4 groups. Group number 1 was still taking the shot but included exercise. Group number 2 took the shot but continued with the usual activity. Group number 3, we did exercise with the placebo, and group number 4, the usual activity with the placebo. Now, I'm not going to get into, the crazy numbers here, but basically, big result of this study is that the group that kept taking the shot or even stopped the shot and did the exercise maintained more of the weight loss than the other groups. Fair to say is that all the groups somehow or regain at least some of the weight back, but that's very normal and that's very much expected. That's okay. That's that's nothing really crazy, but more weight loss was maintained by the group that or by the groups that participated in exercise. The type of exercise they did in the study was recommended by the World Health Organization, which was basically most of the cardio type of exercise, right? But here I would say from a personal experience with people or with clients on these medications, it is very much recommended to do some sort of a strength training on the side as well. Why? Strength training helps you maintain at least some muscle mass, which is very much needed after the end of taking the medication. The more muscle mass we have, the higher the metabolism, or the higher the metabolic rate. So it will be eventually easier to maintain that weight loss. Also, exercise, the type of exercise that you choose when it comes to, like strength training, basically helps you build new muscle mass as well, which again increases your daily metabolic rate at rest. So, to sum it all up, again, no news here. If you don't like exercising, I'm not going to tell you, to do that, but there are certainly benefits, right? There are more and more, papers are coming out, which pretty much just keeps confirming that exercise is a very important item or a very important component of weight loss. And it doesn't matter if you do it the quote unquote natural way or you get the help from one of these medications. Here I would kind of recommend that exercise of your choice needs to be something that you enjoy, right? Obviously, we're not going to do it if it's not fun. Any type of exercise will do. If you're short on time, get on 15, 20, 30-minute walks. It's still more than nothing. You can do some quick, 15-minute workouts at home. Again, anything is better than nothing. Doesn't have to be, you know, like daily type of going to the gym. No, exercise, we can't walk, like take your dogs out, take your kids out. If you find it really difficult to stick to it, find a friend, get a coach, right? Find someone who keeps you accountable. You're much more likely to stick to it if you are accountable towards someone else, because we're just so easy to lie to ourselves, right? Pick an exercise, pick an activity that you're going to enjoy. Also, maybe try to, if you're someone who likes planning, try to plan it into your daily schedule. Again, you're much more likely to do it when it's planned, when you have allocated a time slot for it. So, little tricks. And again, if you don't have time for it, I mean, I'm pretty sure everyone can find 15-20 minutes in a day to do at least something. Walk on a treadmill, you know, like little things. Do a YouTube workout. So, yeah, do exercise no matter, you know, how you're attempting the weight loss. And again, from the experience of working with clients, going either still using the shot or, you know, we're using it before, exercise is definitely one of the things that will help you maintain as much of that weight loss as you can. Okay. If you guys have any questions, pop them down into the comments and I'll speak to you soon. Bye.